A 72-year-old woman sat across from her vascular surgeon, frustrated and confused. Her legs had been swollen for months. By 3 in the afternoon, they felt like they were filled with sand, heavy, tight, aching from the knees down. She had already been to her primary doctor, who told her it was probably just aging. She had tried compression socks. She had tried elevating her feet at night. Nothing changed. So she finally ended up in a surgeon's office, expecting to hear about blocked arteries or a failing heart. Instead, the surgeon looked at her legs, asked her a few questions about her daily routine, and said something she never expected. "Your heart is fine. Your arteries look reasonable for your age. The problem is in your calves. They've stopped doing their job." She stared at him. Her calves. How could her calves possibly be responsible for swollen ankles, aching legs, and that crushing heaviness she felt every single afternoon? But what he explained next is something that most people over 70 never hear clearly, and it changes everything once you understand it. Deep inside your lower legs, tucked behind the shin bones, sits a group of muscles that perform one of the most critical functions in your entire circulatory system. Every time these muscles contract, they squeeze the deep veins running through them, physically pushing blood upward against gravity and back toward your heart. Without that pumping action, blood has no efficient way to climb from your feet back to your chest. Gravity wins. Blood pools. Fluid leaks into the surrounding tissue, and your legs pay the price with swelling, heaviness, discomfort, and over time, real damage. Doctors have known about this mechanism for decades. In medical training, they call it the calf muscle pump, and some refer to it as the second heart. Not as a metaphor, as a description of function. Your calves literally pump blood the way your heart does, just in a different direction. Here is the part that should get your attention. After 70, most people are sitting for the vast majority of their day. The calves barely move, the pump barely fires, and slowly, without any dramatic event or diagnosis, the entire system starts to fail. The legs swell, the ankles ache, the heaviness creeps in earlier and earlier in the day. And most people just accept it. They assume this is what getting older feels like. But it doesn't have to be. What if reactivating that second heart was far simpler than anyone told you? What if a handful of gentle, deliberate movements, none of them requiring a gym or any equipment at all, could wake that pump back up and make your legs feel lighter, more comfortable, and more reliable within just a few weeks? That is exactly what we are going to walk through today. And the starting point is understanding why the advice you have probably already received isn't quite enough. Section 2. Why your legs feel heavy. And why walking isn't enough. When most seniors mention heavy or swollen legs to their doctor, the conversation usually goes one of two ways. Either they are told it is just part of aging, or they are told to walk more. Both of those responses miss something important. Walking is wonderful. It is one of the best things you can do for your overall health at any age. But walking alone does not give your calf muscles the concentrated, deliberate signal they need to function as an effective pump, especially after 70, when those muscles have already lost significant strength and coordination. Think about what happens when you walk. Your foot strikes the ground, your calf contracts briefly to push off, and then it relaxes as the leg swings forward. That contraction is real, but it is fast, shallow, and spread across many other muscle groups at the same time. The calf gets a partial signal at best. Compare that to what happens when you sit in a chair and slowly, deliberately raise your heels off the ground, hold for a moment, then lower them back down with control. That isolated, focused contraction sends a much stronger pump signal through the veins. The squeeze is deeper. The duration is longer. The blood gets pushed upward with real force. A study published in the Journal of Applied Physiology in 2021 confirmed exactly this. Researchers followed a group of older adults who had mild circulation problems in their lower legs. They were not asked to run, jog, or do anything strenuous. They were given simple, targeted calf activation exercises to perform while seated. Within several weeks, venous blood return had improved significantly. The participants reported less swelling, less heaviness, and more comfort throughout the day. The researchers concluded that targeted calf activation was more effective for venous return than general walking in this population. That finding matters enormously because it means the solution is not about doing more. It is about doing something more specific. Your calves need a clear, focused signal. They need to contract fully, hold briefly, and release with control. That is what wakes the pump back up. And once it is awake, the difference in how your legs feel can be remarkable. But the calf pump is only the beginning. What most people do not realize is that the joints sitting directly above those muscles, the ankles and knees, play their own role in circulation. And when those joints stiffen up from inactivity, they create bottlenecks that even a strong calf pump cannot fully overcome. That is why the approach we are going to walk through does not stop at the calves. It builds upward, layer by layer, in the exact sequence your body needs. If you walked into a vascular clinic tomorrow complaining about heavy swollen legs, there is a very good chance the first thing they would teach you is this exercise. Not a pill, not a procedure, a movement. And it is so simple that most people underestimate it completely. You sit in a sturdy chair with both feet flat on the floor, about hip-width apart. Your back is tall. Your hands rest comfortably on your thighs or on the sides of the chair. From this position, you slowly lift both heels off the ground as high as feels comfortable, keeping the balls of your feet planted. You pause at the top for a full second or two, feeling the calves tighten. Then you lower your heels back to the floor with deliberate control. That is one repetition. It looks like nothing. And that is precisely why it works so well for people who have stopped trusting their legs. What is actually happening inside your lower legs during this movement is profound. As the calf muscles contract, they squeeze the deep veins that run through the muscle tissue. Blood that has been sitting in the lower legs gets physically pushed upward through one-way valves in the veins. When you lower your heels and the muscles relax, the veins refill with blood from below. Then the next contraction pushes that blood up again. Lift, squeeze, push. Lower, refill. Lift, squeeze, push. You are manually operating your second heart. Each repetition is a heartbeat for your legs. The key is control. Rushing through this movement defeats the purpose entirely. Fast bouncing does not give the veins enough time to fill between contractions, and it does not create a strong enough squeeze to push blood effectively. Slow, deliberate repetitions with a pause at the top are what generate real circulatory benefit. The other mistake people make is holding their breath. When you hold your breath during any form of muscle contraction, pressure builds in your chest, which actually impedes venous return. That is the opposite of what you want. Breathe normally. Breathe calmly. Let the rhythm of the movement find its own pace. Most people who try this for the first time are surprised by two things. First, how quickly their calves fatigue, which tells them exactly how dormant those muscles have been. And second, how different their legs feel afterward. There is often an immediate sense of lightness, like pressure has been released. That is not imagination. That is blood that was pooled in the lower legs, being mechanically pushed back into circulation. If you feel mild cramping the first few times, reduce the height of the lift. You do not need to raise your heels dramatically. Even a small lift creates a meaningful contraction. Over days and weeks, your calves will strengthen, the range will increase naturally, and the pump will grow more powerful. This exercise can be done multiple times a day, while watching television, while sitting at the kitchen table, while waiting in a doctor's office. There is no equipment, no risk, and no minimum fitness level required. It is the foundation, the ignition switch for everything that comes next. And what comes next addresses a problem that most people never think about: the joints sitting just above those newly awakened calves. Once your calves start firing again, there's another piece of the puzzle that needs attention. Blood does not travel in a straight line from your feet to your heart. It moves through a network of veins that wind around joints, through muscle compartments, and past connective tissue. When those joints are stiff and the surrounding muscles are inactive, the pathway narrows. Blood flow slows. Even a strong calf pump cannot overcome a bottleneck at the knee or ankle if those areas have locked up from hours of sitting motionless. This is where a simple seated movement makes a meaningful difference. You remain in your chair with your back tall and your hands resting on the seat for light support. One leg at a time, you slowly slide your foot back toward the chair. bending the knee gently. Then you guide the foot forward again until the leg is almost straight. The motion is unhurried and smooth, like you are guiding the joint through its natural range rather than forcing it anywhere. As the knee bends and straightens, the muscles surrounding it, the lower quadriceps, the hamstrings, the connective tissue behind the knee, all contract and relax in a gentle rhythm. This rhythmic action does two things simultaneously. It encourages blood to keep moving through the veins behind the knee, an area where pooling commonly occurs in older adults, and it reduces the stiffness that accumulates from prolonged sitting, which itself restricts circulation. The Cleveland Clinic has published guidance emphasizing that gentle, repeated joint movement improves venous return and reduces stiffness in older adults, particularly when combined with calf activation. The combination matters. Calf pumping alone pushes blood upward, but if the pathway above is constricted by a stiff, immobile knee, the effect is diminished. Opening that pathway with smooth, controlled knee motion allows the blood pushed by the calves to travel freely. Think of it this way: your calves are the engine, your knees and ankles are the highway. If the highway is blocked, the engine's power gets wasted. This movement clears the road. The most important thing to remember here is that this is not a strength exercise. You are not trying to straighten your leg with force or bend your knee as far as it will go. You are moving within a comfortable range, gently and repeatedly, with the sole purpose of keeping fluid moving and joints lubricated. If you feel any discomfort in the knee, shorten the range, move less, not more. The benefit comes from repetition and consistency, not from pushing through pain. After a few days of combining these two seated movements, the calf activation and the knee flow, many people notice something they were not expecting. Standing up from the chair feels different, easier, less stiff. The legs feel less like dead weight and more like they are actually participating. That sensation is not coincidental. It is the direct result of blood moving more efficiently and muscles remembering how to cooperate. And it sets the stage perfectly for the moment when you stand up and ask your legs to do something they may have been struggling with for years. There is a moment that happens dozens of times every single day that most people take completely for granted until it becomes difficult. Standing up from a chair. For a younger person, it is automatic. For someone over 70, whose leg circulation has been sluggish and whose muscles have weakened, it can feel like a small battle every time. Knees protest. Legs feel unsteady. There is that brief second of doubt where you are not entirely sure your legs will hold. This is where we bridge the gap between seated circulation exercises and real functional movement that impacts your daily life. The first step is gentle supported weight shifting. You stand behind a sturdy chair or next to a kitchen counter, with your hands resting lightly on the surface for safety. Your feet are about hip width apart. From this position, you slowly shift your weight slightly onto your right leg, then gently back to center, then onto your left leg, and back to center again. The movement is small and calm. You are not lifting either foot off the ground. You are not testing your balance to its limit. You are simply teaching your legs and hips to share the load smoothly, the way they need to every time you take a step, turn a corner, or reach for something on a shelf. The Mayo Clinic has emphasized that supported standing movements improve both lower limb circulation and neuromuscular coordination in older adults, especially when balance confidence has declined. What that means in practical terms is that this slow, rhythmic weight shifting does more than you would expect. Every time your weight settles onto one leg, the muscles on that side contract to stabilize you. That contraction squeezes the veins, pushing blood upward. Then the weight shifts, the muscles relax, and blood refills. It is the same pumping principle as the seated calf raise, but now involving much larger muscle groups across the entire leg and hip. And it is rebuilding the brain-to-muscle communication pathways that weaken when standing and moving become less frequent. Once that weight shifting feels comfortable, the real game changer arrives. The chair-assisted sit-to-stand. This single movement is widely considered one of the most important functional exercises for anyone over 70, and its impact on circulation is massive. You sit in a sturdy chair with your feet flat, positioned slightly behind your knees. You lean forward just enough to bring your weight over your feet. Then you rise slowly, taking a full 3 seconds to reach standing. You pause at the top. Then you sit back down even more slowly, controlling every inch of the descent. Your hands can rest on the armrests or on your thighs for extra support if needed. Harvard Health Publishing has highlighted that sit-to-stand movements improve lower body muscle activation and support venous blood flow in older adults when performed slowly and consistently. The reason is straightforward. When you stand up, the largest muscles in your body fire simultaneously. Your quadriceps, your glutes, your calves, your core, they all contract together in a coordinated burst. That coordinated contraction creates a powerful wave of pressure through the venous system, pushing blood upward from the feet, through the legs, and back toward the heart. It is the most potent, natural pump action your lower body can produce. The critical mistake most people make is dropping back into the chair quickly. When you fall into the seat instead of lowering yourself with control, you eliminate the eccentric phase of the movement, which is where much of the strength and circulation benefit lives. Sitting down slowly keeps the muscles engaged far longer than standing up does. It is the hidden half of the exercise, and most people skip it without realizing what they are losing. Start with just 3 or 4 repetitions. If that feels manageable, add 1 more the next day. There is no rush. The goal is not to exhaust your legs. The goal is to remind your circulatory system what it feels like when large muscle groups fire together with purpose. After a week of combining the seated calf raises, the knee flow, the weight shifts, and the sit to stand, most people report a noticeable difference. Legs feel more awake. The afternoon heaviness arrives later, or not at all. Standing feels more stable. And there is often a quiet return of confidence that is harder to measure, but impossible to miss. But there is still one more movement, and many clinicians consider it the single most valuable exercise for leg circulation after 70. If you could only do one exercise for leg circulation for the rest of your life, this is the one most professionals would tell you to choose. Not because it is intense, not because it is complicated, but because it combines every element your legs need into a single, smooth, repeatable movement. It brings together calf activation, weight transfer, knee engagement, and standing strength in one flowing sequence. And it mirrors the exact movement patterns your body uses every single day. You stand behind a chair or next to a counter with your hands resting lightly on the surface. Feet are hip-width apart. You begin by slowly raising your heels off the ground, feeling your calves engage just like in the seated exercise, except now your calves are bearing your full body weight. You pause briefly at the top of the lift, then you lower your heels back to the floor with control. From there, without rushing, you bend your knees slightly, just a few inches, as if you were beginning to sit down but changed your mind. You straighten back up to full standing. That is 1 repetition. Heel lift, pause, lower, gentle bend, stand tall. What makes this movement so effective is that it activates the venous pump at every level of the leg simultaneously. The calf raise squeezes the deep veins in the lower leg. The weight-bearing position engages the muscles around the ankles and knees. The gentle bend activates the quadriceps and glutes. Every major muscle group in the lower body participates, and every major vein gets squeezed in sequence. It is like running a wave of pressure from the floor to the hip, pushing blood upward through the entire system in one coordinated action. The National Institutes of Health has published guidance confirming that combined lower body muscle activation improves venous return and functional mobility in older adults more effectively than isolated movements performed separately. That is the key insight. Isolated calf raises help. Isolated knee bends help. But when you put them together in a flowing sequence, the circulatory benefit multiplies. The muscles work as a team, the way they were designed to, and the veins respond accordingly. The most important rule with this exercise is patience. This is not a squat. It is not a fitness challenge. The knee bend should be shallow, comfortable, and completely within your control. If you feel any instability, rely more on your hands. If the heel raise feels too demanding at first, reduce the height. The power of this movement is in its consistency, not its intensity. Doing 5 smooth, controlled repetitions every morning and every evening will accomplish more for your legs than 50 rushed, sloppy ones ever could. People who build this into their daily routine often describe it as the moment things clicked. The individual pieces, the calf activation, the joint mobility, the weight shifting, the the sit-to-stand strength, they all converge in this one movement. And when they converge, the effect on circulation is greater than the sum of the parts. Your legs are no longer performing isolated exercises. They are rehearsing real life. Standing up from a chair, stepping forward, adjusting your balance, walking across a room. These daily actions all require exactly the muscle coordination this exercise trains, and the circulatory benefits carry over into every one of them. But what does it actually feel like when all of this starts working? What changes should you expect, and when? One of the biggest reasons people give up on any health routine is that nobody tells them what to realistically expect. So let me be direct about what happens when you start practicing these movements consistently, based on what clinicians observe and what patients actually report. In the first few days, the changes are subtle but real. Your calves will fatigue faster than you expect, which is not a bad sign. It is an honest signal that those muscles have been underused. After the exercises, many people notice an immediate feeling of lightness in the lower legs. That heaviness that usually settles in by mid-afternoon may arrive a little later or feel a little less intense. You might also feel a slight soreness in the calves, similar to how any muscle feels after being used for the first time in a while. That fades quickly. Within the first 2 weeks, assuming you are doing the seated calf raises and knee flow daily and adding the standing exercises every other day, most people notice a more consistent change. The afternoon swelling that used to be a given starts to reduce. Ankles that were puffy by dinner look noticeably better. There's less stiffness when you stand up after sitting for a while. The legs feel more ready, more willing to participate. Sleep sometimes improves too, and that connection is not accidental. When fluid is not pooling in the lower legs all day, the body does not have to work as hard to redistribute it at night. You rest more comfortably. You wake up with less residual tightness. By the 4 to 6 week mark, something deeper shifts. The exercises feel easier, not because you are cheating them, but because your muscles are genuinely stronger and your circulatory system is more responsive. Standing up from a chair requires less effort. Walking feels more confident. The fear of unsteadiness that quietly follows many seniors through their day begins to soften. Balance improves, not because you practice standing on one foot, but because the muscles responsible for stabilizing you are now firing more consistently and more powerfully. And here is the part that often surprises people the most. The benefits extend beyond the legs. When blood circulates more efficiently through the lower body, the heart does not have to work as hard to pull it back up. Blood pressure often improves slightly. Energy levels become more stable throughout the day instead of crashing in the afternoon. Some people report that their thinking feels clearer, which makes physiological sense. Better circulation means better oxygen delivery everywhere, including the brain. The long-term picture is where this really matters. Consistent, gentle leg circulation exercises performed over months and years do not just relieve symptoms, they protect against decline. Fall risk decreases because the muscles and reflexes responsible for catching yourself are active and engaged. Independence is preserved because standing up, walking to the kitchen, climbing a few steps, and moving through daily life remain within reach. The fear that slowly creeps in after 70, the quiet worry that your legs might not hold you, that worry starts to loosen its grip. And it loosens not because you ignored it, but because you did something about it. Gently, consistently, and on your own terms. None of this requires a gym membership. None of it requires equipment. None of it requires you to push through pain or exhaustion. It only requires you to show up, sit in your chair or stand behind it, and give your legs a few minutes of deliberate attention each day. The body responds. It always does, when the signal is clear and consistent. There is a belief that hangs over aging like a shadow. The belief that decline is inevitable. That once your legs start feeling heavy and unreliable, that is simply the direction things go from now on. That you are on a one-way road toward less mobility, less comfort, and less control. I want to challenge that belief directly, because the evidence does not support it, and neither does what clinicians see in their practices every single day. The human body at 70, at 80, even beyond, retains an extraordinary capacity to adapt. Muscles that have been dormant for years can be reactivated. Circulation that is slowed can be improved. Joints that feel locked can regain comfortable range of motion. The body does not stop responding to the right signals just because a certain number of birthdays have passed. It simply needs those signals to be appropriate, gentle instead of aggressive, consistent instead of sporadic, respectful of where you are today instead of punishing you for not being where you were 20 years ago. That is the thread running through everything we covered today. The seated calf raises that wake up your second heart. The ankle and knee flow that clears the pathway for blood to travel freely. The supported weight shifts that teach your legs to share the load with confidence. The sit to stand that fires every major muscle group in coordination. And the standing heel to bend flow that ties it all together into one practical, repeatable movement. None of these are dramatic. None of them will make you breathless or sore for days. But practiced consistently, they form a quiet, powerful system that supports your legs from the inside out. Circulation improves, swelling reduces, heaviness lifts, balance sharpens, confidence returns. The most meaningful health changes after 70 almost never come from grand gestures. They come from small, intentional choices repeated day after day. Choosing to lift your heels while you sit and watch the evening news. Choosing to stand up slowly instead of launching yourself out of the chair. Choosing to shift your weight gently from one leg to the other while waiting for the coffee to brew. These are not workouts. They are habits. And habits over time reshape what your body is capable of. Your legs carried you through decades of life. They walked you to school, chased after your children, stood beside you at every important moment. They deserve more than being written off because of a number on a calendar. They deserve to be reminded of what they can still do. And when you remind them gently and consistently, they remember. They always remember.